Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders past, present, and emerging. Hey everyone, and welcome to All Together, the Family Science Insights podcast, produced by Ellen Massell, the Life Management Science Labs. We are champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week we bring you scientific and practical insights on each element, with the expert knowledge of professionals in the field. I'm your host, Dina Sargent. Let's get started.
Hello and welcome back to the show. These days, there's a host of contraception options out there, from implants, IUDs, and injections to pills and barium methods. And this variety of choices enables us to adhere to our family planning desires, whether it's a set number of children or adequate spacing between pregnancies. But Lissa talked about fertility awareness methods, which offer a natural and effective approach to family planning based on fertility knowledge. So in this episode, we'll be looking at the effectiveness of such methods, what we'll need to know and consider, and how to use them accurately. And guiding us through this is registered nurse Dr. Karin Hammerberg, a senior research fellow in the School of Public Health and Preventative Medicine at Monash University. Karin's main research interests include fertility and preconception health promotion, health and development of children born as a result of assisted conception, and more. So, hi, Karin. Welcome to the show.
Thank
How
you.
are you doing?
Oh, good. Thank you. Very good. Thank you.
Yeah, that's great to hear. So, before we begin, tell us a bit about your background and what your research entails.
So I come from a clinical background. As you mentioned, I am a nurse. My nursing was in midwifery for starters, but then in the early 80s, which is a very long time ago, I was part of the research team at University Hospital in Gothenburg in Sweden, where the first IVF baby was born in 1982, so a very long time ago. And that really spurred a whole movement around the world, as you might be aware, that there are now about 10 million IVF born people around. So I worked with in clinical infertility care in IVF clinics, first in Sweden and then in Australia for about 20 years. And then my career took me into academic work. And after some years working in research, I did a PhD. And my whole PhD focused on the experience of birth and mothering, like having babies after IVF treatment. It was an interesting study and probably one of the first of looking at what happens after IVF treatment.
Yeah.
And since then, I have been an academic in research, and my research is mostly focused on the psychosocial aspects of fertility, infertility, and all the emotional stuff that comes with infertility treatment, and of the follow-up of children born after IVF is also something that we are keenly looking at.
Wow, that's amazing. So we're extremely fortunate to have you share your expertise on the show with us. So what are some common misconceptions you've heard about fertility awareness? How would you address them?
Yeah, so we talk about fertility awareness as something that has got to do with the understanding the menstrual cycle, meaning that you know that there's only certain times of the menstrual cycle when a woman can get pregnant. As far as that goes, I think the most common misconception is probably that, pregnancy can happen anytime. In the broader context of fertility awareness, which we'll be talking about later, it's really understanding everything that affects your fertility and your reproductive health, and how you can, what the things are that you can do to improve your chances of having the number of children you want to have, whether that's 0 or 1 or 4. And so I think that's the bigger context of fertility awareness. But the menstrual cycle misunderstanding, I think, is common, that, you can get pregnant anytime, but you actually can't.
Okay, so that's a great preface for our topic for today. But before we go further into detail, I'd love to get to know you better. So this is Have You Met Karin? And my first question for you is, what is your favorite book?
Yeah, so I knew you had that question for me, so I had to think because I love books in general. But I read one recently which is called Lola in the Mirror. It's by an author called Trent Dalton, an Australian author. He wrote The Boy Who Swallowed Universe as well. And his writing is absolutely amazing. And they take you on wild rides into the underbelly of Brisbane and all the weird and wonderful things that happen to the characters in his book. I highly recommend it.
Oh, that sounds pretty fantastical almost.
It is.
Yeah, that sounds fun. Is that the kind of genre that you prefer?
Well, I just really love his writing, and The Boy Who Swallowed Universe became a Netflix success, and I love that too. So, an author I really appreciate.
All right. Well, that sounds like a great recommendation. I've yet to watch the movie, so I've got to put that on my list, which is really long. But speaking of movies, what movie have you enjoyed recently?
Yeah, so I went to see, and it's quite dark, but I did go and see this movie just the other day called Lee, the name Lee. And Lee was a really ahead of her time woman who was a model in the 1930s. And then when the Second World War broke out, she became a wartime photographer. And she took a lot of the really disturbing pictures of the Holocaust. And the movie was about her story because her son, she had one son, he found a whole box of photos up in the attic after she was dead. And he put together her story about where she traveled and what she did. And the main actor, the person who was Lee in the film was Kate Winslet, and she did an absolutely amazing job.
Yeah,
so
okay, that sounds
quite dark, but very good and very engaged.
It sounds like a grappling one.
It was very grappling. Yeah.
Okay, I have to add that to my list too. It's ever growing. But apart from movies and books, are you listening to any podcasts at the moment?
I am a little bit of an ABC kind of, I love the ABC shows mostly, but I do love one that's called If You're Listening. It's a journalist called Matt Bevan.
Yeah.
And he talks about all the big stories in the world and has some kind of explanation and interpretation of why things happen and how they happen. And to counterbalance that, because mostly that's quite depressing stuff, as you can imagine, with climate change and other things happening. The other one is something called the Conversations, I think it's called. And this is just interviews with very, impressive and inspiring people. Life stories that you hear and that you often take some kind of joy out of listening to.
Yeah, well, you're really giving good recommendations on this podcast. So that's
good.
Great. I do love a podcast with commentary from a journalist because they've had experience with writing and it's always so engaging. And having that translated to audio form it is always very entertaining. So I do enjoy that and informative at the same time, of course.
Yeah.
Thank you for sharing those. And in your personal life or your professional life, either one, is there anyone that you look up to?
Well, I do look up to quite a lot of people, but at the moment, because everything is so politicized and I find it really difficult to deal with this dichotomy. You're either left or you're right. And I have come to be very fond of all the women in our parliament who are teals. They're strong, they're articulate, and they are very, they have intentions that I think are very honourable and much less kind of self-serving in my way of judging than a lot of the kind of career politicians that have been in politics for all their lives. So good clap from me for all the teal women in the federal parliament.
I have to agree with that. And I do find that it aligns with me a lot better to look up to people for specific traits rather than as a whole person, just because we don't actually know these people as people. We know them for what they have achieved, for what they portray. So the most I can really pick out is like what traits I do admire, and so I do find that relatable, yes. But my last question for you before we end off this icebreaker section is there a course that you've taken in your lifetime that's inspired you and stuck around to this day?
Yeah, I have to say, being a nurse and a midwife and all the education it took to get there. Much later in my life, when I was in my 50s, I did a PhD. And obviously that's a big time commitment. It's 3 years, but it's an incredible learning experience, I have to say. And I had very good supervisors. And once you have done something like that, I feel you become a real expert on your own topic. It might be a small topic, but at least you're the one who probably know more about that topic than anyone else because you've read everything that was ever written about it. Plus you've done your own research to kind of advance the field. And I found that really satisfying. But, you've got to have 3 years of your life devoted to it. But as long as you enjoy it and as long as it takes you to, a place where you feel that you're better off, I think it's worthwhile.
Yeah. And what lessons have you learned from during your PhD?
Well, you have to be very resilient and you have to obviously have very good time management, and you have to really be a critical thinker. That's probably the most important thing, because again, you can read papers that have been published in the scientific literature, but you have to have the ability to look at it closer, see whether the outcomes that they present actually match what the data shows. You have to be a critical reader and say something about, a study that involves 10 people might not tell you as much as a study that involves 1,000 people, but it depends on the method that's been used. So critically appraising the scientific literature is one of the biggest lessons I think you learn as a PhD candidate.
Yeah, I have to say that during a PhD sounds incredibly intense, and I just imagine having all this decision paralysis because there's so many things you have to think about. You can't just cherry pick information that you like or that would serve you well for like a favorable outcome in your PhD. So it does require a lot of that resilience, like you said.
I had to learn a lot of statistics too, and that's not for the faint-hearted, let me tell you.
It really isn't.
No.
There's so many numbers and so much, not just numbers, it's also all this interpretation that you need to do, analysis that you need to do, where these numbers come from. So yeah. Well, thank you very much for sharing that. It's
Pleasure.
been such a delight to break the ice. Now let's move on to the interview. And for starters, what would you say your definition of family is?
Well, that's a good question for starters, because to me, family used to be the nuclear family, mum and a dad and kids. But as we know, there's so much more to the concept of family. People might live with 3 other people in a house and they consider themselves family. They can be linked through genes, they can be related, or they may not be. And I want to apply the broadest possible understanding of family. And it's very disturbing to me when people say, would you like to have a family? And they mean, would you like to have children? Because even people who don't have children have a family. And they might have just each other that they live with, but they are considering themselves a family, of course. So family to me, I think, should be for anyone who feels connected to, and usually it means that you actually live with the people in a household. But we do have, as we have mentioned before, there is donor conception, there's adoption, there's fostering, there's all sorts of things. And I think inclusion is the most important part of family, and people should appreciate and consider themselves family with whoever they like.
Yeah, for sure. And more specific for our topic for today, could you elaborate on what fertility awareness is? How can it be used to achieve reproductive goals?
Yeah, so as I mentioned earlier, there is that narrow understanding the fertility awareness specifically in that context means that you understand what happens in the menstrual cycle, and that is that, you know, the beginning of it is after your period, or when your period starts, the next cycle starts, and you know, about halfway into that, if you have a regular cycle, an egg is released. So the first part is just growing that follicle that's going to release the one egg. The egg is released, and the second part is basically the egg kind of waiting to be fertilized. And if it is, an embryo forms and it implants. If it isn't, you know, 2 weeks later, you get your next period. And it's really understanding that fertility or conception is only possible on that day of ovulation and the 5 days leading up to it. So usually after the egg has ovulated, the horse is bolted, it's really too late. Sperm can survive for a couple of days in the woman's uterus, but an egg has a very short, so once it's released, it needs to be fertilized within the next day. And if that doesn't happen, it just disintegrates and the next period starts. So what fertility awareness means is that you know and understand the signs that ovulation is imminent. And the signs are that the vaginal mucus becomes, you know, clear and slippery. And I always think of it, it's a bit like egg white, and it becomes the perfect vehicle for sperm to swim along. So, and that happens before ovulation. So once you notice that, and people who are good at it and who have regular cycles, they can pretty much pinpoint exactly when they ovulate. And then thinking, you know, if you want a child, that would be the perfect time to have sex, obviously. But if you don't want a child, they would be the days to avoid sex. So somehow it's not perfectly accurate. And I really don't want people to, you know, stop using the pill and thinking that they can, you know, manage their fertility just with fertility awareness, because it's quite a bit of hit and miss. But in general terms, it is possible to have a pretty good idea of when you're most likely to conceive and when it's probably next to impossible to conceive. So that's that narrow definition of fertility awareness, and people use it to promote fertility and try to achieve pregnancy, but also to avoid it. So either way. But as I said, it's not foolproof in any way. But for people who are actively wanting to be pregnant, it's very important to be aware of it, because they can then optimize their chances. But the big picture for fertility awareness is really this whole understanding the whole reproductive biology and understanding what the factors are that will make it easier or harder to conceive and have children. And I should read, you know, what the actual definition is, and I'll explain it as I go.
Yeah,
because it's a lot to take in. But fertility awareness in this broader context is the understanding of reproduction, which is quite a big thing to understand, actually, if you think about it. And fecundability, meaning the monthly chance of conceiving, and also the understanding of the related individual risk factors. And those include things like being older. Age is the most important factor that really drives your chance of conception. Sexual health factors such as sexually transmitted infections, they can block your tubes and they can really damage your reproductive tract. And lifestyle factors such as smoking and obesity. So they are the individual factors that people can look at and optimize if they feel that they would like to, you know, contribute to their reproductive health. But there's also the non-individual risk factors, and that is things like environmental chemicals, workplace chemicals, and all the things we're exposed to in the modern world. They also actually have an impact on our reproductive functioning, and it's important that people are aware of them and at least try to avoid the ones that you can avoid. We can't avoid everything because it's everywhere, but there are some things you can avoid. And then it also includes awareness of the societal and the cultural factors that affect the options we have. Because you can imagine in some countries you can't actually probably have an abortion or you can't access contraception. And that would clearly impact on your reproductive trajectory. But also, you need to be in a place where you have everything you need to be able to do family planning and reproductive planning, and then to build the family that you would like to have. So it's a lot to take in, but I think that broader definition is much more helpful because it actually really also includes men. Fertility is very much focused on women, and women need to do this and women need to do that. And of course, everyone thinks once a woman is pregnant, she needs to, look after herself and her health. But we need to be much more thinking broadly about this because men can do an awful lot to contribute to the chance of having babies and also to the health of the babies by being the best possible health before conception. So that goes well beyond what most people have in mind when they think about fertility awareness, I think.
Yeah, 100%. And so what should men be aware of when it comes to fertility awareness?
Well, they need to be aware, firstly, that the woman's age is the biggest factor that's going to determine whether they can or can't have children. We know from research that men want children just as much as women do. It's kind of a stereotype that women are the ones who want children and men don't care. That's not true. If you ask any young man, 95% of them will say, yeah, they want to have children sometime. But unless you then understand that there is a biology around all this and you can only have children during a certain part of your life. And if you forever think that, we can do it later, a lot of people miss out. And I've heard too many women, too many men say that I didn't know that, age had such an important influence on. So we ask people in research, when do you think fertility drops off for a woman? And a huge percentage of them said after 40. But I mean, after 40, it's a really, really uphill battle. People need to have a much more deeper understanding of what is actually possible biologically. So I think men need to understand women's biology. They, of course, have a longer reproductive lifespan. We know that older men can impregnate a woman. But it's also important for them to know that it gets harder for men to achieve pregnancy with their partner after age 45. And there is much more, there is more problems with the health of children of older fathers. So age is an important one, but men can also optimize the health of their children by being as healthy as possible before conception, because the health of the person will affect the health of the sperm. And if the conditions are optimal before conception, the chance of the baby being in good health when it's born increases. So it takes a bit of planning, all this. So it's not like you can, once a pregnancy is achieved, you can start to do all these things. And it involves not smoking, it's the big one that really has damage on the sperm. Not vaping, no drugs, trying to stay in the healthy weight range, not consuming excessive alcohol. It's really the usual suspects for staying healthy. But all of those things will, taken together, make a difference to the health of your future child. So it's really worth doing.
Yeah. And for both men and women, in what cases would you say that fertility awareness is less suitable? For example, if a female has irregular periods or something like that?
Yeah, if you talk about fertility awareness in the sense of understanding the menstrual cycle, I think if a woman has irregular cycles, it's almost impossible to know when ovulation happens, because ovulation happens 2 weeks before the next period. So usually we think of it a 28-day cycle, halfway through you ovulate, and then you have your period 2 weeks later. But, women have 35-day cycles. And if they do, you ovulate on day 21, not on day 14. So it's less useful as a method to promote or to avoid pregnancy, if we talk about fertility awareness in that context. Less useful for people who have no periods or irregular periods. So I think you can use the kind of natural fertility method to a point, but it really does have its limitations. But as far as the bigger picture, same thing for women. understanding the biology and what is possible biologically, and when the reproductive lifespan, the most fertile you are is in your early 20s. But women these days don't have children in their early 20s because there's too much to do. We want to be educated, we want to have a professional career, we want to do all sorts of things. But at least knowing in your thinking and in your planning of your life, if children is something you really want, once you hit your 30s and certainly 35, I think you need to be aware that if children is high up on the agenda of what you want to do, you need to get cracking, basically. And the other problem, I think, sometimes is that people think that they can wait, and if it doesn't work, they can always use IVF treatment. But the sad news is that IVF is not very good for age-related infertility. So it's the quality of the eggs, basically, that deteriorate. And people think that you can probably conceive up until you hit menopause when periods stop. But the reality is that pregnancy is almost impossible for about 10 years before menopause. So that's another idea that I think people think that as long as you have periods, you can actually conceive. But very unlikely, average age of menopause is about 51. And in the last 6 or 7 years, it's so rare that pregnancies occur. So we need to kind of just be aware of the impact of age and also of anything else, because again, as for men, it's the usual suspects. Exercise is important, good nutrition. For women specifically, if they plan a pregnancy, to make sure that they take a multivitamin, a folate, and that also has to happen before conception. If you take the folate, vitamin B basically, a few months before conception and through your pregnancy, you can avoid about 70% of all neural tube defect, spina bifida. Very, very powerful preventive strategy that costs next to nothing and it doesn't have any side effects. But knowing all of these things means that there are some things we can do to improve, the reproductive outcomes that we hope to achieve.
Yeah. And I've also been told by doctors in the past, as someone with an irregular cycle, that if I do want children in the future, that fertility pills are available and they are effective. And how accurate is this for family planning purposes?
Yeah, so what I think they're probably talking about is something called clomiphene or Tamex. There's a few different brands, but what it actually does, it's an anti-estrogen. So it tricks your body to think that there's not enough estrogen, and therefore you start to produce hormones to promote ovulation. So it's a drug that and there's in tablet form for if there's no other problem, you can definitely take a course of tablets. They will monitor your ovaries to make sure that you don't kind of produce 5 or 6 eggs, because then, of course, if you have sex, you could potentially have a multiple pregnancy, which you want to avoid at every cost. So, but usually it can be well monitored. You can see on ultrasound what develops. Once there is an egg that's developing, you can get a trigger injection to make sure the egg is released, and you time intercourse accordingly. So if the only problem is, irregular cycles, that can be managed quite easily and may not even require, because if you do have periods now and then, you're probably still ovulating. So, the general advice is to just have as much sex as possible if you want to have children. So that might appeal to some.
Yeah. But you mentioned that age is really important when it comes to conceiving, and that it's about the quality of the egg. What would the situation be like for someone with an irregular cycle who is reaching that point of 35 or 36? Would it be as effective?
Yeah, the drugs you can use to stimulate ovulation, they work at any age, really. It's just that whatever the egg is that is released will be the age of the woman, obviously, because we have all the eggs we will ever have from birth. So what happens over time is that there are mutations and there are, abnormalities creep in. And actually the same happens for men. So men with after 45 had much less higher quality sperm than they have when they're younger. And so age naturally, and I mean, if you think of it from an evolutionary point of view, we never used to live for as long as we do these days. So there was no reason why older women, and also I think evolutionary, being an older person and having children means that there was no one to look after the child if you died. So I think it's a perfectly natural kind of consequence of evolution that we have a reproductive years and then they stop because the offspring could potentially be orphaned if they were born any later. So I think there's good reasons for it. We just need to understand biology a bit better, I think.
Yeah, okay. So you do make it a point that understanding biology is crucial to fertility awareness and using them. So could you elaborate a little bit more about what that is? What are the most important things that we need to know that most people don't?
Yeah, I kind of come back to the idea that, reproduction involves a lot of intricate kind of interactions. Obviously, in the individual, you've got to ovulate, you've got to produce sperm, and then the two has to come together, and it's a very complicated process, and it's quite magical, really, that anyone was ever born because a lot of things have to go right. So understanding all of that, and I do think it's important to understand that, because we have contraception, and modern contraceptions are very, very effective, and it's almost like with that knowledge, and what happens in schools is that kids learn everything about contraception, but they don't learn anything about reproduction. They know that, eggs and sperm are needed to make a baby. But I think already in school, we should introduce the idea of fertility protection and help kids understand, even from an early age, that fertility is something that's here for a period of time, but it's not there forever. And with contraception, I think people find that, you can turn off fertility by using them, and somehow at the other end, you can just turn it on again if you stop contraception. But it's not quite that simple. It doesn't always go to plan. So even if you have good contraception, once you stop using them, you might find that you try for month after month and nothing happens. And it can be quite distressing for people to, especially if you have that idea that I've stopped the pill and therefore I get pregnant. It doesn't actually always happen like that. There's about, 15% of people will experience fertility difficulties, and they will try month after month and nothing is going to happen. They might go to a doctor and they might find that, the fallopian tubes are blocked, or he doesn't have any good sperm, or there could be all sorts of problems that contribute to this. And you wouldn't really know until you try for a baby. So it can be quite a journey, I think, for people when they try for a baby and nothing happens. It's quite distressing. And of course, another level of distress is once you decide and have infertility treatment, that is a grueling experience as well.
Yeah. So with fertility treatment, what are the chances of increasing fertility? I'm not sure how that's measured. Can you bring us through that?
Yeah, it is. The most kind of basic infertility treatment is what we talked about before. We call it ovulation induction, taking some tablets and sometimes injections to help a woman ovulate. That's kind of the simple part of it. But once you go into things like IVF, it really is quite involved and it's quite expensive, and it's also very emotionally draining. It involves a long series of injections, and you have to go into hospital and the eggs are retrieved, sperm is added, and hopefully embryos develop. If there are some embryos there, a few days later, you have one of them transferred into the uterus, and hopefully it'll take. If there are more than one embryo, they can be frozen, and you can come back and use them without having all the injections. So that's kind of the long and short of it. But the thing is that there's actually a potential risk of failure at every one of these stages. So you might not get as many eggs as you hope. They might not fertilize. The embryos might not look so good, and whatever embryo you get back might not take. So in the bigger picture, if you think of everyone that walks into a clinic to hopefully have a baby, about half will come out with a baby, but the other half won't. And a lot of the ones that are younger have a much, much greater chance than the ones that are older. And that's, again, the impact of age on the quality of the eggs. That is pretty much the biggest driver of whether you will succeed with IVF or not. And then for the older women who really have it's a kind of futile treatment, there is the option of using donated eggs. And if the eggs are donated by a woman who's, in her 30s or whatever, the chance immediately increases to the chance that a woman of that age would have. So that's the option you can resort to if you have reached a point in your life when you don't really respond to infertility treatment.
Yeah. Wow, that sounds like a lot to consider. And there are just so many factors at play here. So apart from that, what is your best advice for people who are a bit older and want to conceive?
Well, I guess we usually say that if you want a child and you're under 35, you can try at least for a year. Because the monthly chance, you're not going to have a chance every month. But after a year of trying, if nothing's happened, it's a useful thing to go and have a checkup and a sperm analysis and check on the basic things that need to function for a pregnancy to happen. But we do say that if a woman is 35 or older, it's best to seek advice after about 6 months of trying, because if there is something wrong, it's better to get onto it sooner rather than later, because again, age does kind of catch up on you. So it depends on your age, but I think that the most important thing for someone who is in their late 30s or early 40s is to have realistic expectations.
Yeah.
And unfortunately, clinic websites are full of pink and blue babies, and it's really quite seductive, and it's easy to think that all you need to do is to go to the clinic and you'll have a baby. Unfortunately, that's not the reality, especially not for older women. So I think being a more kind of assertive consumer of information and really getting the facts about what the chances are. There's quite a lot of studies now that show what is your cumulative chance, meaning once you've had all your embryos put back, and it's so clear, age is the biggest driver. So if you're 35, if you have 3 full cycles of IVF, you might have a 70% chance of having a baby. But if you're 42, it's probably about 10%.
Oh, wow.
So it really is, if you go into it, have realistic expectations, and you might be the lucky one. But if things don't work out, I think it's important to either move on and use donor eggs, or move on and find out what the rest of your life is going to be, how it's going to play out, and what other things you got to do if it actually doesn't work. But to continue treatment when there's such a low chance is sometimes more soul destroying, I think, than actually trying to move on.
Yeah, I can imagine it must be such emotional turmoil. And that's not taking into account miscarriages even, which
That's true.
happen pretty often.
Yeah. About 20%, like 1 in 5 IVF pregnancies miscarry. So that's the other thing, that you often see pregnancy rates on IVF clinics, but a pregnancy is not a baby.
Yeah.
And when you see percentages for what's quoted, you really need to understand, is it of the women who start treatment, or is it of the women who have an embryo transfer? Because if you've reached that stage, you're already in a better group. And also, is it a child or is it a pregnancy? Because as I said, 1 in 5 pregnancies in IVF and also in nature actually miscarry.
Yeah.
Mostly because there's something chromosomally wrong with the fetus.
Oh, that's unfortunate.
Yes.
Yeah. Well, there are other options as well of having children, like adoption or donor conception, like you said. So what do you think are some other considerations that have to be made when engaging in fertility awareness methods?
Well, the latest kind of thing that's come up now is egg freezing.
Yeah.
And kind of linked to that is this AMH testing. These are two of my kind of pet. I don't hate them, but I understand that there's a lot of misinformation around about these two things. AMH is called the anti-Mullerian hormone. It's a hormone that you can measure, which is an indicator of the number of eggs that are available in the ovaries. And because the numbers decline with age, younger women usually have a higher AMH and older women a lower AMH. But the thing about it, and it's sold as an egg timer test. It's sold as all sorts of things. You can buy it online and do it at home and get a number. The catch is that this number has got absolutely nothing to do with your chance of conception.
Oh.
Yes. Who would have known?
Yeah.
It says something about the number of eggs, but nothing about their quality.
Right.
And it's been studied intensively. And you can say a woman who's 30, who has a low AMH, has got the same chance of a pregnancy as a woman who's 30, who's got a high AMH. So it's really the age again that matters. There are instances when AMH testing can be helpful, and that's when women go into IVF treatment, because it'll give an idea to the doctor about how much of the fertility drugs she will need to produce a good number of eggs. So in that scenario, it's helpful, but it's not helpful for people who don't have a fertility problem, who want to know something about their fertility, because it can't tell you anything about your fertility. And the problem with that is that if you get a high reading, you might think that I've got all the time in the world.
Yeah.
And if you get a low reading, you might think, oh my God, I need to get going, or I need to freeze my eggs. And both of these things are no good for decision making because it's based on a test that has no value in terms of predicting your chance of having a baby. So if nothing else is taken away from this podcast, I'm hoping that is. And then for women who freeze eggs, I think that it's also again promoted as an insurance policy, but I'd like to call it's much more like a lottery than an insurance.
Yeah.
It is definitely an option that people consider, and they should consider, but they should consider it with all the information that they need to make a good decision for themselves.
With a bucket of salt.
Yes, and the reality of egg freezing is that for most people, to get the number of eggs you need to have a reasonable chance down the track to actually have a baby, it's quite a large number of eggs. And usually you're not going to get them in one go. So you have these hormones and you retrieve the eggs. Because the numbers are like in the 20s and 30s. And you might get 8 or 9 eggs. And of course, the younger you are, the more eggs you get. And of course, also the younger you are, the fewer eggs you need because they are better quality. But generally speaking, if you see the cost of egg freezing being something like $8,000, you have to multiply that by 2 or 3 if you want to have, a decent chance of a baby. But the other point is that of all the people, and studies are coming out now pretty thick and fast, only about between 10 and 15% of women come back and use their eggs. And that's because they conceive without using them. Or they don't want to be a single parent and they haven't found a partner, and therefore they don't use them with donor sperm, which is an option. And some women feel that I'll freeze my eggs, and if I don't find a partner down the track, I'll go back and use my eggs and be a single mother. But for others, that's just not an option. And they freeze their eggs. They're hoping to find a partner who's willing to commit to parenthood, and they don't. And the last thing is that, of the 15 percent who use their eggs, only about a third have a baby. So for an insurance policy, it's a pretty crappy. And I think that knowing all of these things, women will still freeze their eggs because a lot of women feel that that's, at least I feel I've done something and it gives me a bit of peace of mind. I understand that it may not work, but I feel better having done it. All good. But I do think that the women who go in thinking, I'll put my eggs away, and this is how it's advertised on clinic websites, leave your eggs with us and come back and use them when you're ready. Well, maybe, but you know, that there's no guarantee of a baby. That's the bottom line.
Yeah, and there's another part of that when it comes to leaving your eggs and coming back when you're ready. You're not sure when you'll be ready, and there's a good chance that you'll be ready when you're 50 or 60. And by then, tell us how that experience is like for someone in their middle years to go through a pregnancy.
Yeah, I think most clinic wouldn't actually even want to return them if you're in your 50s. I know anecdotally there are stories in the world where a woman in her 60s has a baby. But I'll tell you what, pregnancy is the most risky thing a woman can do when she's young. And it's even more risky when she's older. And then you have to imagine that you would want to stay alive for at least, you know, the first 2 decades of your child's life.
Yeah, that would be nice.
And that would be nice. And even how much enjoyment you can get. That it's the risky pregnancy is more risk to the baby, but also it's a slug to have a newborn, and then to raise a child is much harder when you're older than when you're younger. That's the bottom line. But people do it, and people, again, I think all of these things people should do whatever they think is the right thing for them, but just equipped with all the information to actually weigh up the pros and cons.
Yeah. And we've talked about IVF and some other technologies in fertility awareness as well now. But from what you know, what are the emerging trends in technologies in fertility awareness?
Not so much in fertility awareness, apart from, me banging on endlessly about helping people to be more inquisitive, understand fertility, and knowing how reproduction actually works. I am hoping that one innovation is more public education about fertility. And again, I think it needs to start at school. And the other thing that I think we've become much more aware of is the importance of what I talked before about the pre-conception health, the health of both parents before conception, and getting men involved in pregnancy planning, understanding the limitations of fertility, and that if everyone is in the best possible health before conception, the next generation of children will be a healthier lot. So I think that's quite a profound public health message, that there are actually things we all can do to give our children the best chance of growing up healthy. In terms of technology, there's all sorts of things happening in the IVF laboratory, including automation, AI. AI is used a lot in the kind of assessment of quality of embryos, because you feed the AI kind of monster all this information, and then they can tell you things based on the algorithm. So a lot of those more technical things are happening in the lab. Whether that actually will increase the chance of IVF working is debatable, because most of what makes IVF work is the quality of the egg and the quality of the sperm. So there might be slight kind of improvements in certain areas. But apart from that, I think it's almost as successful as it can be. And I think for people who go into IVF, it's really important to understand that, or think of it as a series of treatment rather than a one-off. Again, clinic websites make you think that, you have a cycle of IVF, you go home with a baby. It's not the reality. And I think it's much better to be well prepared, to think in advance, how many cycles can I afford? How many cycles can I kind of psychologically take? And maybe set a number. And of course you can stop earlier, but once you reach maybe say 3 cycles and nothing's happened, you kind of have permission to stop. Because it's very easy to get caught up and thinking maybe the next time. So think of it as a series of treatment. because in all likelihood, it's not going to happen the first time. So you have better idea of what to expect. If you go by the advertising, I think you can be very, very disappointed if you don't achieve a pregnancy after your first cycle. But I think it's more the rule than the exception that you don't. And therefore, be prepared and set up a support system. Make sure you got enough money to pay for it. And there's a lot to consider if you go into these medically assisted treatments. Overall, it's practiced very, very responsibly in Australia. Mostly women only have one embryo put back, which means we have come away from all these multiple births that we used to have, which are very difficult, for the family, but also for children often come out with health problems in multiple births. So I think it's practiced very well in Australia, and we have regulation around it. We have registers for when people use donor eggs and sperm so that the child can come back and know, their genetics. And we also screen donors and make sure that, everyone is as healthy as possible. So I think generally IVF is practiced very responsibly in Australia. And but I do think that there could be more done to prepare people better for the fact that it probably is not going to work the first time, to help people who pursue treatment endlessly to help them stop, and also to provide some care for the half of the people who come to IVF who don't have a baby. I think they often drop off the perch, and there's not much effort to help them through a transition to a child-free life.
Sure, yeah, that sounds like it would be nice for expectant parents who have not managed to get pregnant to at least be presented with some alternative options. But what do you hope to see in the future of fertility awareness and its role in family planning?
I'm hoping to see, as I said before, the integration of not just how you avoid pregnancy, but how you can promote pregnancy if you want it, into basic education, school education. I think we need to talk about kids that, if you want babies, you need to have a healthy body, and you can't have babies anytime you like, and that there are things that can happen that stops you from having babies. I think all that idea, the holistic kind of approach to fertility and contraception and conception need to happen together. And I also hope that when people of reproductive age go to the GP for, vaccination or whatever, that they ask this one question: would you like to have a baby in the next 12 months? The reason for doing that is that if the person says no, there is the opportunity to talk about reliable contraception. Because if you don't want a pregnancy, you want to really make sure you don't get pregnant, because then you're faced with either having a child or having an abortion. And if it wasn't planned, I think it's much better to, do what you can to avoid it. But also if the person says yes, this is the opportunity for the GP to say, well, remember, there are things you can do before you conceive. So if you're planning a pregnancy, make sure you take folate, make sure you come for a checkup so I can make sure you've got all the vaccinations you need, and that you optimize your health, and that the partner's health is so a preconception health checkup is what I really, really advise everyone who plans a pregnancy. Go and see your GP. There's a list of things that they can do that's actually going to help, and you're going to have up-to-date pap smears, and there's a lot of things that prevention is always better than cure. So there are a raft of things you can do before pregnancy, including making sure that you got the rubella vaccine, so you don't actually, risk having something happen to the pregnancy once it's established. So preconception health appointments, and that means that GPs need to get better at asking this one question. It's called the one key question. And I think it's important to ask men and women these questions, men and women of reproductive age. And it takes about 30 seconds because you don't want to do a preconception health check there and then. But you tell the person, come back and see me, and we'll set up an appointment, and we'll do all these things to make sure that you have the best chance possible of having a baby. So even asking that question will make people aware and think that, there is a way of doing pregnancy planning that I think really makes everything, the future health of the child better.
Yeah, 100%. That sounds like an incredibly useful question to ask. So thank you so much for sharing all of your expertise with us. Now let's talk about some practices and habits. What is a habit that you would recommend doing that will support one's fertility awareness?
Again, if we come back to the narrow definition, it means monitoring your cycle length. There are a lot of ovulation calculators out there, and they can be helpful because if you plug in your last 3 period dates, it can give you a rough estimate of when you might be ovulating. It's important not to trust it completely because it's biology here and it's not always straight line. There can be aberrations. You can have a longer or a shorter period. But monitoring, your cycle length, being aware of when ovulation happens, and really monitoring the vaginal mucus. They are the things that will really give you an idea of when you have the maximum chance of conceiving, or if you want to avoid pregnancy, when you really need to abstain or use condoms or use something so that you avoid pregnancy if you don't want it. So there will be. In the bigger picture, the practice would be to get very informed about everything fertility. And I often try to give a real shout out to men and make them really active partners in this reproductive decision making, because waiting forever means a lot of people miss out, and they need to be on board, and they can't drag the chain. They have to be, helping make the decisions that people want. And I actually suggest that people who are in new relationships, I don't think on day one, but soon enough into a relationship, that you even talk about what are your future plans and what would you like to see. And for a woman who really wants children, if he says, well, I want children in 10 years and she's 35, I think she needs to consider whether he's really the best partner or whether she might go looking for someone else. Yeah. It can be difficult conversations to have, but very useful.
Yeah.
And to make sure that you have expectations that align for the future of the relationship. Because I think there's often women hang around some guys and they presume that, and that we're going to have kids sometime. But anytime she brings it up, he says he wants to wait. And it's a very common thing to happen. So I think putting it out there early so that you don't waste a few very important years in terms of your reproduction, if you're really keen to have children. I think early conversations and making sure that you're in the same kind of space and have the same aspirations is really important.
Yeah, for sure. I think that early conversations about this are really important and should be way more normalized, just because, you want to get that out of the way. Not that it's like I wouldn't call it an uncomfortable conversation to have. I call it a frank conversation to have. And it's really important to get this out of the way just because you want to make sure your expectations are aligned, for sure. It's for the betterment of the relationship. It's for the betterment of your future. The sooner, not to be too... Oh gosh, I sound really too efficient. I sound too efficient for saying this, but genuinely, I sometimes do feel like the sooner you talk about it, the sooner you can decide where your relationship stands. Otherwise, how you evaluate your relationship is kind of based on this idea that either one has of it that might not be very accurate because you don't have full information about it, right? I think that's a good practice to do. Of course, it sometimes with some people, I do understand it might not be as comfortable to take the efficient route. But yeah, I think it's good to try and get comfortable with talking about these things. And you did mention several times during the interview that, we should be doing our own research, and we should be just learning more about fertility awareness, just being more aware of the information. So what are your best recommendations for doing our own research online? What should we be looking out for when it comes to research?
Very good question, because there's so much information. We have done several studies of the content on fertility clinic websites, and that really gives you a very skewed picture of what actually is possible. So I think it's important to because these are commercial entities and they're selling stuff. But I think if you want to get really independent information, you need to go to government-sponsored health information websites. You need to look for credible sources of information. There's also a new kind of phenomenon, and that's influencers giving you their journeys, their fertility journeys, and they nearly always end with a baby, and that probably not the best source of information either. So I think being an assertive and a consumer of information and looking for information that really has credibility and that's evidence-based and that's transparent and most importantly independent. So there are some government-sponsored health websites and I think going to talk to a GP or speak to a fertility specialist should be helpful as well. There's something called Wiser Healthcare, and they have a little pamphlet with 5 questions that we should always ask, not just in fertility care, but in any medical care, where we're talking about taking a drug or having a procedure or a test of some sort. I can't remember the 5 questions, but it's something like, what will it do for me? What will happen if I don't have it? How much does it cost? What are the side effects? And one more. If you get those questions answered honestly, you can make a good call on whether the pros outweigh the cons. And being a very assertive healthcare consumer, I think is important across the board, because there is a lot of healthcare that's either unnecessary, not proven, because that goes for the IVF scenario as well. There's a lot of what they call add-ons. You have IVF, it doesn't work. Next time you can have IVF and then some other thing. We call them add-ons. There's a whole collective of things. The thing about the add-ons is that they don't actually have evidence to support their benefits. And people say, well, I'll try anything, because that's what happens when you're desperate. But an add-on that doesn't have proven benefits, we also don't know if it's got risks. So risks and benefits are really important to be aware of. And something that is not proven to be beneficial might actually have adverse, it might make things worse. So we shouldn't jump on anything only because it's new and you can try it. I think asking all the right questions and then making a decision is important.
Yeah. Well, thank you so much for sharing all of that with us, Karin. Now let's move on to the open mic section. And this is your opportunity to talk about anything that you're passionate about. And it doesn't have to be related to the topic. So the floor is entirely yours. Please take it away.
Oh, wow. My gosh. I do think that you might have realized that fertility education is one of my passions.
I took a guess.
You took a guess on that. Yeah, good on you. Yeah, but apart from that, I think in my own life, good research. I love good research. And I love listening to people who produce good research. And because we live in a world where there's a lot of you can publish anything. But really, when you see the good stuff, you realize that, there are really solid researchers out there. That's on the research scenario. Apart from that, oh my God, I love traveling. And my latest trips have been to the north of Australia, traveling on a beautiful boat across the Kimberleys, ending up in Broome, and you have seen more beauty than you'll ever see in your life when you've done that trip. It's absolutely fantastic. So,
Oh, wow.
yeah, I've got another one coming up, which is from Darwin to Cairns. Also 12 days on a beautiful boat with snorkeling and diving. And,
Love snorkeling.
this is when you can actually disconnect from
Yeah.
the internet and from the world,
Yeah.
and just look at the natural beauty, and that's such a pleasure and such a privilege to be able to do.
Yeah, for sure. I always I always say that I despise the beach. I do not like the beach at all. The sand just gets in my up my feet and my toes, and it's just an uncomfortable feeling, and the sweat like paired with the sand, awful. But the moment you go underwater and you snorkel, you forget about everything. It's a whole other world in there, and it's so fascinating too. I can't even begin to imagine what marine biologists are doing. Yeah, but thank you so much, Karen, for joining us today. That was a weird segue. If our listeners want to find out more about you, what you do, where can they go?
Well, there is a profile and all my publications on the Monash University website. Just Google my name. And maybe what I should recommend is I have written an awful lot of pieces around fertility on something called The Conversation.
Oh, yeah.
Yeah. So it's about 25 of them. So Google The Conversation and my name, and I'll share a lot of wisdom with you.
Oh, that's amazing. We'll link those in the show notes.
Very good.
Thank you, everyone, for tuning in, and we'll catch you in the next episode.
You've been listening to Altogether, the Family Science Insights podcast, produced by the Family Science Labs, a division of LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcasts, Google Podcasts, Spotify, and other podcasting apps available on your devices. If you enjoyed this episode, please consider rating our show, sharing it, and subscribing to our channel, as it helps other people find it so that we can grow and bring you more quality resources. More of our work can be found on our website at fa.lmsl.net, where you can join our movement. I'm Dina Sargent. Thanks for tuning in.